Hi, my favorite voice
Yes,
on radio.
sir. So nice to see you again. Yeah.
Good to see you. Good to be here, Kwame.
And
How
how's
are
the
you?
family?
Wonderful.
Absolutely.
Second generation of that year.
Oh, that's right.
Also
Absolutely.
started. Yes, Kwesi went to Presec.
I mean, yeah.
2
It
weeks
had
ago.
to be Presec.
I had to.
I see.
A trophy presentation. It had to be there.
It had to be Presec.
But
that's nice.
It's a new phase of life for us. Watching him go off to boarding house.
Yeah.
Brought a lot of memories.
I can imagine.
Back in the 90s.
Yeah.
When some of us had to make the same journey and taking him to the same place.
Yeah.
But new phase of life. So yeah. Now
When you were talking about new phase of life, I thought you were going to mention the fact that Wobako SS.
Big pal. Imagine I go and visit him, then they'll say, Kwesi, Charlie, your old boy, they look for you. Say, hey, Charlie, me too, old boy. Kwame, then we grow.
Dr. Osafo, Wobako cra.
Oh, Charlie, yes, because I quite now they will call you old boy.
Yeah.
You know, that means Charlie. Well, if you talk, they think that you are not part of the current system of things.
By you.
So
Poppy.
Poppy. So maybe I'll leave the visitation to the old girl.
Oh wow! Congratulations to you both. I think that's a good thing, and I'm happy he went to Presec. Of course, I mean,
yeah.
There are only 2 schools in Ghana, so.
This year, I'm on my home.
Yeah. We are resting.
Right.
Anyway, I know you're also busy with preparations for our open day, which is on the 27th
Fever pitch
of November.
Next week, by this time.
Yeah, actually Thursday. It's not by this time.
Oh, is it?
It's
Wednesday,
on Thursday, next week.
27th.
Kwame,
check a calendar. Check a calendar. We will be live from the premises of Medical Hospital.
It's actually
By now,
I think it was a Thursday. Oh my goodness. Okay, great.
So preparations far advanced. We're putting everything together to make sure that we have a good time with everybody who comes there. But remember, it's an open day of a sort.
Yeah.
So everybody gets to get a tour of all places, including the shrine of the hospital.
The theater, the surgical theater.
Yes. Why people think of it almost like the way they think about going to a shrine. I always see how, I'll be honest, the first time I had to undergo surgery myself, I had some palpitations.
Yeah.
I'll be honest. So yes, we're looking forward, the entire team waiting to receive.
I've
everybody.
never been in the surgical theater before.
Really?
Yes.
Okay, I wouldn't be surprised because what are you going to do there? Anyway?
Yes, I've never,
so most people wouldn't have,
True,
So I think it'll be a good idea to see all the different units of the hospital and just get first-hand experience from the staff who work there about what the different places are for. An X-ray unit. How does it look like? How does it work?
Right.
And I think also people get to know about the sophistication of a hospital. It is technically very demanding to operate a hospital. It is not a simple place, but we're happy to do that and interact with as many people as possible.
I'm especially happy about seeing your surgical theater because hitherto my impression or what I expected a theater to look like was a very cumbersome place because especially when I see what happens on like ER, you know what I mean? Like there's so many gadgets, but I saw your theater and apparently times have changed.
Yes.
So everything is digital and you don't have wires running around left, right, center and cords and I'm like, wow, this is like modern.
There's a lot of miniaturization now in clinical work, and Kwame also depends on the sophistication. I think sometimes depending on what we're going to do, when you set up fully, when you're going to do a particular case, of course, then it can look a bit more clumsy. But what you saw also is because of just the sheer size of our theater space. We have intentions of using it for training.
Okay.
For the next generation nurses, medical students and so on and so forth. So we deliberately made it big to accommodate a lot of people in there.
Well, there you go, guys. Next week, Wednesday, we're all going to be at the Medicas Hospital, East Legon Hills.
Right.
Yeah, so the drive time would come to you live from the venue, and it's open to you. We want to meet you. We want you to come. I'm the doctor on the day. If Dr. Osafo don't you want medicine?
Philip, can I get some
Should I order get you medicine? Should I prescribe some medicine for you?
So Ayarikov.
On that day, I'll be seeing to the sick patient. I will make sure they are healed.
Okay.
Dr. Lexis on that day.
Right.
You can't miss this. So make sure you join us. We'll be there from 3:00.
Right.
It will be live on Joy FM.
Right.
But today we actually have an open clinic, and when we say an open clinic, we've been talking about the sugar disease for the past 2 weeks. Doctor has given us as much information as he could about the condition. Including the etymology and literally everything.
Right. So this week we are going to have an open clinic, and maybe before I open the phone lines, I'll share, a few thoughts about some treatment options.
Okay.
And then we'll open the phone lines.
There you go. The number to call is 0302216541, or you can send us a WhatsApp message on 055-1111997. Okay, so these are the numbers we're working with today. 055-1111997. Send us a WhatsApp message. Any question at all about the sugar disease or diabetes mellitus or diabetes, back on your friend say? Insipidus.
But we're going to do DM today. I like the fact that you remember DI and DM.
Yeah, I remember that as well.
Right.
Yeah.
So, Kwame, just a few points about the last portion of our presentation. When it comes to diabetes, we can manage it, and we can manage it very well. We would like to empower people throughout this presentation for them to be able to take the right decisions as we see it to protect their health. So a few points about managing diabetes. Number one, or I put all of it together and I will say TLC. Kwame, it's not tender loving care, but
I wish.
Therapeutic lifestyle change. That is very, very important. We've done a lot of the education. Now people are empowered with the knowledge about the disease, and they have to take action. So one of the things that we talk about, lifestyle change. I mean, lifestyle change, we're not talking about how often you go to church or you go to the mosque, or what kind of clothes you wear or shoes you wear, the music you listen to. But we're talking about lifestyle in the area of what you eat and drink and how much exercise you get under your belt, or whether or not you live a sedentary lifestyle. All right. And we're saying therapeutic because we're talking about healing. So we're saying that a lifestyle change that brings healing is what we're going to talk about. And the strategies are in these areas. So the first thing is the dietary thing. So Kwame, the reason why we spent time talking about carbohydrates 2 weeks ago, when we talked about the three classes of carbohydrates, the monosaccharides, the disaccharides, and then the polysaccharides, was simply because we wanted to make meaning of the dietary instructions, if you like, that we put forward when we're managing diabetes. So your doctor or probably your dietitian would lead the conversation talking to you about what to avoid, what to eat, how much of what you should eat, when to eat. Well, there's something we call the GI, the glycemic index. The glycemic index is a way we measure how fast you would convert a particular food into glucose and how fast you raise the blood glucose level when you eat that type of food. So that's something that people will come across, the GI, the glycemic index. And we're comparing this to glucose. And there will be a number from 0 to 100. Glucose will get a score of 100. So we're comparing all foods to pure glucose. So if you have a glycemic index of say 60, then we're saying that compared to glucose, this food, if you take in this food, it will raise your blood glucose level to about 60% as much as glucose would have. All right. So the glycemic index is what we usually use in determining which foods you should avoid and which foods you should go for. So generally we would say that take foods with low glycemic index or avoid foods with high glycemic index. So again, your dietitian will go into all of those details about foods that constitute low and foods that constitute high glycemic index. The more refined they are, then the higher they are close to glucose. So again, I talked about the fructose syrup, telling you that it's almost similar to glucose. But a few things like white rice, it has a very high glycemic index. White bread will have high glycemic index. Potatoes, sweet potatoes would have high glycemic index. Foods that will have low glycemic index, green vegetables. So vegetables generally, but green vegetables. Most fruits, but when fruits ripen, then you increase the glycemic index. Raw carrots, kidney beans, and so on. So, and the lentils across board, they will have generally low glycemic index. That's why we'll also advise you to add a lot more of these in fruits in your diet.
Okay.
As well. So Kwame, this is one of the things I wanted to talk about with respect to what you eat.
Okay. Well, this is very good information. If you're listening in and you have any questions, call us now on 0302-216-541 and 0302-216-541. You can send us a WhatsApp message as well on 055-111-1997. Kwesi from Kade says, Lexis, I checked my sugar and it was 4.7. However, my younger brother who's in the UK advised me to do HbA1c test, which gives accurate measure as to whether I will develop diabetes or not. Doc, what is that?
Right. So, Kwame, remember I mentioned that there are 3 different types of tests that we deploy in making a diagnosis of diabetes. So his 4.7, I'm not sure whether it was the first one I talked about, the fasting glucose test, where you undergo an overnight fast between 10 to 14 hours ideally, and then in the first thing in the morning we check your blood glucose. So if we do that, it gives us a number. If that number is 7.0 or more, we would say the individual is diabetic. Another methodology is this HbA1c. We call it the glycated hemoglobin. If you compare it to the fasting glucose, the glycated hemoglobin or this A1C test gives you a retrospective assessment of blood glucose 90 days prior to the test. So unlike the fasting glucose, which is telling you what your glucose is at that moment, having undergone an overnight fast, the glycated hemoglobin is telling you what your blood glucose has been 90 days prior to the day you did the test. It doesn't require fasting because we are looking at 90 days prior to the day you did the test.
Okay.
That period. So it's a retrospective assessment of blood glucose. So sometimes some people want to do some shakara moves if they know they are coming to see Dr. Osafo at the diabetic clinic. So that week then they are good boys and girls.
Right.
And try to eat right and all of those things. So I wouldn't say this is more sort of like superior. It's just a different technique.
Okay.
It gives you a longer period of assessment. And I think Kwame, sometimes we all want that period of assessment.
Yeah.
So we can use all these 3 different methods. And the third method is something we call the OGTT, where we mix some glucose for you when you present, having undergone an overnight fast, and then we check. We do serial measurements of the blood glucose thereafter.
Right.
And all these things give us different ways of making the determination whether you are diabetic.
I think you mentioned that part last week as well.
Right.
Let's see who's here. Hello.
Hello.
Hi.
Lexis.
Yes, sir. You're welcome. What's your name?
My name is Kwesi.
Okay, Kwesi, let's hear you.
In the first place, I don't know. I'm so much curious. I want to know, and which year did Dr. Adi complete his SSS education?
Okay, let's save that conversation for a bit later since we're focusing on the diabetes conversation now. Okay. Hello, are you there? He wanted to know when you completed
96.
SS 96. Okay,
Yeah.
great. I think a few of our friends are waiting to ask about
Our
diabetes.
questions, yeah,
So
yeah.
let's
do that.
try and focus on that for now, and then maybe afterwards we consider the preset conversations. Hello.
Yeah, Papa Lazarus, good afternoon. I hope you're well.
Yes, I'm well, thank you. What's your name?
Ajiman Joseph from tonight.
All right, let's hear you.
Yeah, is it true that if the diabetes thing is not in your blood, you won't get it, or it's a hereditary? Secondly, if someone like me, I'm an exercise person, I do jogging a lot, I do exercise every day, I take food twice and eat cooked food once in a day. But if there's a habit of, say, oh, tomorrow morning I'll go to jogging, so let me drink this sugary thing, whether it be malt or minerals, there's enough sugar, but I don't mind because tomorrow I will go for jogging. Does it work perfectly? Because I will go to jogging and burn calories, I don't mind taking in sugar. And is it by way of eating a food that you are going to add sugar or drinks that contains sugar that you need to avoid?
Right. So thank you very much for the question. Let's take the first one. Talked about whether it is hereditary. So Kwame, I think we addressed that when we mentioned that diabetes is like a genetic disease. There's a genetic predisposition. All right. There's a genetic predisposition, and then you've got also environmental factors that would make the disease or determine how early probably you develop the disease. If you look at type 1 diabetes, then the children, what environmental factors have they been exposed to? What has a 2-year-old done? How much interaction have they had with their environment? So that's what led us to believe that there are some genetic predispositions. There's something that's gone on with the genes that are responsible for determining how much insulin that the cells in the pancreas can produce. So there's always a genetic element to it. But we also don't discount the environmental factors, especially when it comes to type 2 diabetes, because then we're seeing that then the risk factors, the things that also then makes the disease then appear, especially for the type 2 diabetes, there will be things like obesity, the sedentary lifestyle, the dietary issues, and so on and so forth. But by and large, if you have the genetic predisposition, especially for type 2, then it will happen sometime along the line.
Okay.
So,
all right. Let's see who's here. Hello.
okay.
Hello, Lexis.
Yes, sir.
Yeah, I'm the first caller who call.
Okay.
I was going to ask my question, then the line just dropped.
Okay, that's fine.
Indeed, I also completed 96, but
Oh,
I'm
nice.
diabetic. Yes. Well, I attended when you say, when you taking screen away.
Okay,
I'm
okay.
yeah.
All right.
Sure.
I'm a diabetic. And then I asked Doctor the first place, how do you determine that somebody is a type 1 diabetic or a type 2 diabetic in the first place? How do you determine? And then again, I check my sugar once a month. But I don't know if there's any way out. In terms of what they call it, pricking my finger, it hurts a lot. So because of that, I don't usually take it. But I don't know if there could be any device in terms of taking the sugar level, because pricking my finger, it do hurt my fingertips. So it's kind of scare me.
Right.
I don't take it frequently, like maybe once in a week or let's say every 4 days or so. I have to wait maybe in a month, sometimes 2 months before I check my sugar level. But normally, recently it was under control. It was around 5.1 for the past 1 month now. And then I started taking some sugar food, and then it has shot up to, that is fatty blood sugar, last 2 months or so. It was around 10 point something, which is very high.
Right.
And then I'm experiencing severe erectile dysfunction.
Right.
I'm not erecting at all.
Right.
And then at age 46, I don't know
Right.
whether the probability of me having a child in future, is there.
All right. So, Kwame, I think I left out some of the questions for the previous caller. So let me just quickly address that. You talked about the dietary measures. So it's not the diet that or the type of carbohydrate that would make you develop diabetes. That is not the case. But once you're diabetic, then your choices then make a big difference. The issue about, if I'm going to exercise tomorrow and therefore I have I load myself with glucose and I'll burn it, then we're talking about calories and obesity. Because if you're taking a lot of these high or energy dense foods and you don't use it, then your body's going to convert it and store it as fat. So obesity then is one thing. But then if you are diabetic, then we'll not encourage that in the first place. Now let's talk to let's address this current caller. So I think the first question was about
how you determine whether
you are type 1 or type 2. So really you need a blood test. It's not a common blood test, because for type 1 then we believe that your body is attacking the pancreatic cells, the cells of the pancreas that produce the insulin. So we believe it's an autoimmune disease. Your body itself damages the cells of the pancreas, and when it does that, those antibodies that did the damage, they hang around, and therefore we do a test to identify those antibodies. So it's not a very simple test, but it is doable. We do those tests. So that's how you distinguish type 1 and type 2. But previously, the simple way we go about it is the age. So if you find somebody who is 12 years and below and they are diabetic, we automatically assume that they are type 1. All right, but it is possible that you would have a 20-year-old or something who has type 1 diabetes. So really, technically, you need to do a test.
Okay.
Again, he talked about control. From the numbers that he was dropping, if your fasting glucose is 10 at 46 or something at that age, we would say that your glucose control is not optimal. It is not ideal, all right, for your fasting glucose. I'll be interested in knowing what is long-term, glycemic control, the A1C looks like. So if he comes to the clinic, I will check his 3 months or his long-term diabetes control and say that, no, he needs to get better control. Better control means 3 things. We're going to review your diet, we're going to review your exercise activity, and then we're also going to review your medicines. These are the 3 areas. Does he need to be checking his blood glucose frequently? No. There's actually a very simple device that we use to check the blood glucose. Pricking your finger hurts. It's painful. If I have to do it, and I know people are using some needles or the regular needles to prick, that hurts. That hurts really bad. So there's a special device that gives you a very, 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 very gentle prick. All right, that will get the blood to come out. He needs to come through, and then we can provide him with one. It's an automated lancet.
Okay.
But he doesn't need to check his blood glucose as often as he's doing.
Okay.
Except your doctor will tell you that, okay, I'm going to change your medicines. I've changed your treatment plan. So I put you on a glucose profile for a week or so, and I ask you to come back to the hospital. Beyond that, you don't need to become so fixated about checking it all the time.
Okay. And there was one about erectile dysfunction.
Absolutely. He needs to come in, or we need to talk over the phone. I have mentioned it time and again, diabetes is one of the commonest reasons why people develop erectile dysfunction. And if we don't deal with the diabetes, and the number he gave us for his fasting glucose, he has poor control. If you have poor control, it damages the blood vessel network in the male organ, and then erection becomes a problem. Without erection, you're not having sexual intercourse, you're not ejaculating, you're not making any woman pregnant.
Hello.
Hello, Lexis. Good evening.
Yes, sir.
Oti from Tema.
Okay, Oti, let's hear you.
Yes, Lexis. My question is, last time I ate early, so I slept around within 4 hours. I went to hospital. They checked me. My number was, I think, 80 something. It's low. Because more than 4 hours, so it's low. The next day, I just eat the food. I slept like 2 hours. No, I slept before after eating. Within 2 hours, I slept. I went to the hospital. I went to the next day. They check it to me. They check it. That one too. I've got 120. So I said, why today one is like 80? The next day one is 120. I was really worried because how can it check? One of the doctors said that if you eat like 4 hours before you sleep, it's heavy. You're going to hospital. If you check your BP, it comes normal low. But we don't have enough You don't have food like you eat 2 hours before you sleep. If you go and check, it worry you. Is that correct? And
Okay.
how? Yes.
All right.
Okay, thanks for the question. And he's an American, so the units of measurement is they use milligram per deciliter.
Okay.
So we've got to be careful about that. The standard unit that the rest of the world use, we use millimole. All right. So I'm going to convert those numbers, the 80 and then the 120. The 80 would give you what we call 4.4.
Okay.
All right, 4.4 millimole, and then the 120 means 6.6.
Okay.
All right, millimole. The cutoff we use for diabetes is 7.0. Again, for fasting glucose. So I'll make the point. The fasting glucose, and I think Kwame explained it the other time, you need to have undergone an overnight fast, a defined overnight fast, ideally 10 to 12 hours. That's how we have standardized it, and that is how come we can then interpret it. So if you don't undergo a fast for that period, then Kwame, nobody can make interpretation.
Okay.
But I'm not sure about this. If you eat 2 hours and 4 hours, then you get those swings.
Okay.
So we need to standardize the test properly.
All right. Nanajo's message here, I would want us to look at it.
Okay.
Just kindly confirm with doctor if IVF process accelerates sugars. I became diabetic after my first child. I've been trying IVFs, but to no avail, and my sugar gets worse after each IVF cycle. Again, the tingling effect in my legs is, I'm sure you mean, unbearable. What can I do about it?
Right. So, Kwame, there's something we call gestational diabetes. All right. Pregnancy-induced diabetes. The woman is not pregnant, and then it's not diabetic. They get pregnant second trimester, and then they develop diabetes. All right. Either it resolves after the birth of the baby, or it persists. All right. So I am thinking it is gestational diabetes rather than the IVF procedure.
Oh, right. Okay.
Right. So she developed something we call gestational diabetes. That's what is most likely to have happened.
But
And
that can be controlled as well.
Oh yes, absolutely. It has to. It can be.
That's good.
Be
I'm sure
as well.
Nana would want to get in touch with you and
She should.
many other friends who have issues with sugar. So how can
Right.
they reach you?
Right. So anybody who wants to reach me, including Dora, who's sending us a message from UK. This is the second week. Dora, I'll get back to you. The number is 0501 477 340. Our WhatsApp number 0501 477 340.
Dr. Yaw Osafo is the CEO of Medicas Hospital, East Legon Hills, and Mampo Equiapem. Remember, next week, Wednesday, we're going to be live from the new hospital at East Legon Hills, and we are inviting you to come over and meet the team. And if you have any issues as well, they will certainly want to see to you as well. But next week, Wednesday, is the open day. We're having an official launch of the new facility, ultra modern actually, very beautiful facility, and it's a place that you'd want your family to go to if they are unwell. Make Dr. Osafo your family doctor, and you will be as fit as a fiddle. That's it. It's 5 o'clock. We're going to find out what's happening in news now. Thank you so much, Doc, for coming through. Yeah, we're grateful. All right, Hannah is here with the latest updates in news.
And coming up, enjoy headlines.